Okay, so we're going to have another little chat through of something, this time from the tongue, throat, TMJ, sinuses. So these are all part of the stomatognathic system. But in fact, this course about the stomatognathic system is so much more than just TMJ pain. It's all about how the stomatognathic system is involved in bringing a sense of balance and perspective. So it's not just balance, it's balance, mental and emotional balance. And it's also perspective, both cognitively as well as visually, and how all of these things relate to posture and how this upper triangle of the body and is really important in terms of orientation and communication. And how in this zone you get this whole confluence of somatic, autonomic and fluidic considerations. So this really is all about postural and homeostatic communication. Now there's a whole host of functions which involve the same structures in this region. So whether it's speech or chewing or swallowing, head position, turning for vision, auditory signals or vestibular dynamics, all of these things have to have multiple coordinative patterns so that you can have integrative and interrupted functionality. So you can interrupt breathing for speech, or you can interrupt swallowing for breathing, and vice versa, and that you can continue to orient posture as you look at different things and as you detect various different signals in terms of auditory dynamics, and all of this whilst in motion, for example, affecting your vestibular systems. So there's a whole number of things that you can sort of get into within the stomatognathic system, and right from birth, there are osseous strains, myofascial dynamics in the cranium, long-term compensatory balance to the cervicobrachial, OA, and orofacial dysfunctions and so on. There are definitely some neuralgias and neural syndromes in the head and face, but all the bog standard TMJ pain, tongue, dental issues, sinuses, glandular and tonsil function, but also the dynamics of speech and how speech is different from the pediatric patient to the adult patient to the geriatric patient, and so is swallowing. Pediatric swallow is quite different to the adult swallow and so on, and how this whole interrelationship between larynx and upper airway function is really intriguing. And so you're looking at posture and you're looking at why things are the way they are. And if you have dysfunction in the one, where have you compensated throughout your body? And we'll talk about a whole host of relationships with feet, with central tendons, postural realignments globally, and therefore how you are orienting yourself and how in fact the hyoid operates as a real sort of balance point and a gyroscope, if you like. Then we've got some interesting things about the upper cervical spine, and most people have completely forgotten all the diversity of the facetal arrangements in this area, and how you really do have to work out your planes of action for C0, C1, C1, C2. These days I don't do much HVT work at all, not because I don't think it's useful, but because I think so many other things are infinitely more useful. And I do an awful lot of adaptive functional unwinding and so forth. But nonetheless, understanding the complex arrangements of this helps us understand both dural mechanisms, cerebrospinal fluid flow, venous drainage. It helps us orient the eye postures, ear alignment, all sorts of things. It has pharyngeal airway structures, and so on. And so we talk a lot about that, and even just small bits about the C1 spinal nerve, the myodural bridges, all sorts of things that we can get into in this zone. So we're talking about global positioning, we talk about influences of some of the primitive reflexes with respect to the stomatognathic system, and we certainly talk about arousal with respect to social engagement system and the stomatognathic system, and how autonomics come into that. And then, this whole business about TMJ, bite occlusion, force dynamics through the body, fascial planes, and all sorts of things. So when we talk about head and neck pain, we can approach it from a whole host of things, and I do an awful lot on the head, in the head, within the cranial cavity, but from a non-involuntary mechanism perspective. So that's quite important to realise that there are lots of other ways that you can interact in this region without having to resort to cranial releases from the involuntary perspective. So there's lots that we can do, so we'll go through a load of that. We definitely go through the changes from how you grow from infant, how you develop your osseous structures, how you get growth directions, growth plates, how you get enlargement, and how this changes rather the orificial spaces within the cranium, and how it's the space within that's the interesting thing, and it's where this expansion occurs through the face as much as the head, but it's definitely the face, the throat, and how you get orifices from here to here, and how the alignment of these orifices are, whether it's globes or ears or oropharynx. All of these things lead to different usages, and different usages lead to different tissue strains. And as I say, there's a lot of osseous work. It's really fascinating, and periosteal innovation and implications for manual handling of within the bone and on the periosteum, especially you know, from infancy, child through to adulthood. So again, lots of easy techniques in order to get into the bone and work with these osteoperception receptors, and looking at the way that then is picked up and informs sort of neural communication about the status of the head and its contents. So we certainly look then about ordinary, if you like, in inverted commas, TMJ functions. We can look at the discs, we can look at the muscles, we can work out lots of easy ways, apart from doing that, to actually work on the pterygoids and make things more comfortable for patients. We understand, you know, what things are related to TMJ function, and certainly jaw clicking and jaw pain. That's so easy peasy to understand. But what about tingling? What about insomnia? What about visual disturbances? Why are those related to TMJ dysfunction? So we can have an interesting time looking at those. And so when we get into how the TMJ works, but the influence it has autonomically in terms of airflow and then in terms of balance, and all of those things affect sleep quality, and therefore energy, and therefore exchange within the cerebrospinal fluid, and then it brings us into a whole host of brain health with respect to TMJ function, or at least the TMJ in the whole dynamic of the stomatognathic system. So it's really important to go through how TMJ dysfunctions develop, what keeps them going, what we can do about them, what habits relate to them, what self-help things that people can do, so exercises and so on. And some of the exercises that you often do is all about tongue proprioception. Getting this really huge muscle, and this richly innervated muscle, which is a hydrostatic structure. It performs a lot of pressure within the inside aspects of the mouth, and it really shapes and dynamizes what goes on. And so there's all sorts of tongue exercises that one can do to help to disengage the neural patterning adverse pattern within the TMJ control that's useful. So we also talk about epiglottis, hyoid techniques, and how to do these safely without causing impact to the airflow and so on. So literally looking at the wider aspects of TMJ function, all of the accessory muscles, techniques for evaluating the jaw and so on, and ways in which, as I said, the patient can help themselves. So we can certainly drill down into the deep anatomy of the TMJ, the disc, how the pterygoids move the disc, how the disc has to be migrated within jaw movement. What can you do about that? How do you adjust things? What do you understand about what happens inside the TMJ articulation itself? And what are the key muscles that are involved? And in fact, where many of these muscles are actually inferior, and with jaw opening, I mean, everybody knows about jaw closing, crunching, teeth clenching, all of this sort of tension here. Well, how do you open your jaw? Does it just fall open? And so there are issues whereby the inferior jaw opening digastric components are really informative to the balancing of this relationship between maxilla, mandible, hyoid, airway structures and so on. So the concept of opening one's jaw is really intriguing. And this relationship between opening and closing, talking, chewing, placing the jaw in the right place for a whole variety of other functionalities, including vocalizations, is really interesting. And so we talk about the anatomy, we talk about the innovation of it, and we really understand how you have this huge numbers of delicate slings, proprioceptive tissues, stylohyoid ligaments, for example. We're monitoring how there's this juxtaposition between, throat structures, pharyngeal structures, and therefore how tongue is placed, TMJ is held, and how pterygoid's finally balanced. And we look at intraoral work, as I said, in a hopefully an easy dynamic. We look at buccal massage. We look at again, as how all of these things relate to the tone of the palate, the airflow, and therefore then all sorts of interesting things with respect to ears, the way that air is necessary for the health of the respiratory system. We talk about sinuses, sinus development, eustachian tubes, turbinate airflow, and then nasal health, mucosal health, drainage into this nasal space. So these zones, this functionality of this part is really interesting, and so many people don't think of this when they think of the diaphragm. In our other little snippet lecture, we talk all about aspects of the diaphragm, and we touch on this, that, and the other. But in fact, one of the major determinants of the way that the diaphragm is poorly functioning is the way it's trying to drag suction air down through your nostrils. So if this upper respiratory air tract is not good, the motor effort to get your diaphragmatic lowering, to get your lung tissue stretched, to increase the negative vacuum, to draw in that bolus of air from through the nose in the first instance, how all of that is important is a strong influence to diaphragmatic function. So that's why we keep often having overlapping sorts of dynamics in lots of different talks and units, because there's so many ways of interpreting a problem, and many manual therapists and osteopaths, they've been told, oh, this is the technique for the diaphragm, and then you put it in your diaphragm box and forget it, and then you don't add anything to it, or you don't take that technique out of the box and use it for something else, or you don't understand, okay, well, if that diaphragm technique doesn't work, well, what then? What's it not responding to? What else is trying to feed signals or movement pressures or other sorts of functionalities in respect to that zone? So it's really important that you understand in much greater depth the integrative nature of many of these structures, so that you can get a much better relevance as to why you do a thing, when you do it, when not to do it, how to prioritize, and how to combine it into a big sort of plan. And then therefore hopefully more effectively move your patient on in a much more global sense. So yeah, we talk about all sorts of things to do with that, and hopefully that was a little interesting introductory snippet. Thank you.